Malaria is a potentially life-threatening acute illness which is caused by the Plasmodium parasite, which is of different species. However, P. falciparum is the most common on the African continent and is responsible for most malarial deaths. According to the WHO, Sub-Saharan Africa accounts for 90% of malarial cases and 91% of malarial deaths. The malarial parasite is transmitted through the female Anopheles mosquitoes. Anopheles mosquitoes lay their eggs in water, which hatches into larvae and eventually grows into the adult mosquitoes. The female Anopheles mosquitoes seek a blood meal to nurture their eggs. They bite humans and transmit the Plasmodium parasite while sucking blood. Parasites migrate to the liver, where they multiply before migrating to the red blood cells, which they eventually destroy. These invade more red blood cells, leading to anemia and other symptoms of malaria. During a blood meal, another mosquito bites a person with malaria and ingests the parasites, thus perpetuating the cycle. In individuals with low or no immunity, symptoms usually appear between 10 to 15 days after a bite from an infected mosquito. The first symptoms are usually fever, headaches, and chills, which are usually difficult to recognize as malaria. Severe malaria, especially in children, can lead to severe anemia, low blood sugar, amidst other symptoms leading to death. In endemic areas such as Sub-Saharan Africa, asymptomatic malaria is frequent. The first thing to do when you notice symptoms of malaria is to visit the nearest health facility to get tested. At our clinic, we conduct a 3-level testing system for malaria using the rapid diagnostic test, confirmation through microscopy, and PCR DNA amplification assay test for malaria. This is very important to ensure that a person is positively confirmed to have malaria and to prevent the growing antimalarial resistance. As we speak, we are one of the 2 clinics in Nigeria to use this advanced lab testing. Malaria is treated using artemisinin-based combination therapy. However, this would only be prescribed to you after diagnosis at a registered health facility. If you're confirmed to have malaria, a medical practitioner will prescribe an antimalarial drug. Even with diagnosis and treatment protocols available, preventing malaria through vector control is the best course of action. Vector control means interrupting the development of some stages of the Anopheles mosquito's life cycle. 2 forms of vector control are recommended. 1. The long-lasting insecticide-treated mosquito nets and indoor residual spraying. These are both recommended by the WHO and are effective in a wide range of circumstances. Finally, it is important that you get tested before you're treated for malaria. Also, ensure that you complete your antimalarials as prescribed to you to help us to keep fighting malaria.